So my name is Graham. This is for respiratory 2480. It is February 20th, 2025, and we are going to go over our six-part video series. This is the first video in that series over hemodynamics and circulatory shock. So what is shock? So shock refers to a lifetime or a life-threatening condition where the body's circulatory system fails to deliver adequate blood flow to the organs and tissues. This results in a lack of oxygen and nutrients, which can lead to cell damage and organ failure. Shock can be caused by a various amount of factors, such as blood loss, heart failure, severe infection, allergic reaction, and trauma. Shock is a serious condition and should be treated immediately. We're going to go over the 4 types of shock in this video series, which are hypovolemic, distributive, cardiogenic, and obstructive shock. The first one, I'm just going to go over these briefly in this video just to get an overview of them. So hypovolemic shock, which is more referred to as like a type of volume loss shock, it refers to a medical or surgical condition in which rapid fluid loss results in multiple organ failure due to inadequate circulating volume and subsequent inadequate perfusion. Due to oxygen deprivation, endothelial cell death is induced following hypovolemic shock. Most often, hypovolemic shock is secondary to rapid blood loss, hence the volume lost. Distributive shock has to do with vasodilation. So this results from excessive vasodilation and the impaired distribution of blood flow. So septic shock is the most common form of distributive shock and is characterized by considerable mortality. So if it's treated, around 30% survive, or around 30%. If it's treated, around 30% will not survive. And then if it's untreated, greater than 80% will not survive. Other causes of distributive shock include systemic inflammatory response syndrome due to non-infectious inflammatory conditions such as burns and pancreatitis, toxic shock syndrome, anaphylaxis reactions to drugs or toxins, including insect bites, transfusion reactions, and heavy metal poisoning, hepatic insufficiency, and neurogenic shock due to the brain or spinal cord injury. In the United States, this is the leading cause of non-cardiac death in intensive care units. Cardiogenic shock, aka type of pump failure in your heart. The clinical definition of cardiogenic shock is a decreased cardiac output and evidence of tissue hypoxia in the presence of adequate intravascular volume. So this is the leading cause of death in acute myocardial infarction, with mortality rates as high as 50%. In the absence of aggressive and highly experienced technical care. So again, shock is immediate. You need immediate care. Obstructive shock is an obstruction of blood circulation. So this is a condition that prevents blood and oxygen from getting to your organs. You need immediate treatment of the problem that causes emergency, such as like a clot or collapsed lung. Survival rates for this type of shock, which is a more rare shock, are better than survival rates for the other common types of shock. With any type of shock, your entire body can't get enough blood flow, which means it can't get enough oxygen. But with this type of shock, there's an obstruction or something getting in the way of the blood going in and out of your heart or great vessels. This obstruction can quickly lead to a huge drop in blood pressure and the amount of blood your heart is able to pump. So the shortage of oxygen that this creates will affect your entire body. But that is all I have for the overview of all the shocks, and I will see you in the next video. Thank you.